Good morning, ladies and gentlemen. May I take this opportunity to greet all of you on behalf of the Indians from Bangalore. We appreciate your conference in a great manner. Incidentally, Fifth World Dental Conference is being held at Barcelona, Spain, and in fact I was invited to participate in this program. Unfortunately, due to the circumstances and as a result of the COVID-19, I am unable to travel to Barcelona, and I am here with presenting my small message of the decision making and treatment planning in periodontics. Incidentally, the periodontal diseases have been ubiquitous. No man is free from it, no race is free from it. It is like a scourge upon mankind. There are over 700 species of microorganisms present in the body, in our mouth. And incidentally, this particular periodontal diseases have been unchallenged and been present in every corner of the world, wherever it is. And today we are still finding in the crossroads to have a solution for the treatment procedures. I am afraid that to tell you it is going to be a long journey of periodontal treatment and decision making, and therefore I am trying to give a small anecdote of procedures that we are going to follow in the management of periodontal diseases. As you know, that periodontal diseases are also correlated with systemic conditions also. Many situations like rheumatoid arthritis, or it could be even heart diseases, or it could be even cerebrovascular strokes, or it could be in the form of possibly of endocrinal origin, all have repercussions on periodontal tissues. There's a two-way side effect, one from the systemic to the oral changes, and from oral changes to the systemic effects, and therefore we have to be very much aware of all the changes that are taking place. So friends, as we have been telling you that periodontal diseases happens to be omnipresent, it is present all over the world, and we have many different ways of doing treatment, both in way of doing the non-surgical and surgical methods of periodontal treatment. Incidentally, we have to take a decision, and that decision making in periodontics is important for diagnosis and treatment execution. When we try to do a treatment, first and foremost step is we have to take the patient history, and we have to find out what for the patient has come and redress the treatment accordingly. And history should also include the charting system, and therefore we have to follow the norms of periodontal examination. A successful dentist is one who knows what the patient has and what and when and how we have to execute so that the treatment is in a proper manner. There are 4 different phases in which the dental treatment or periodontal treatment can be undertaken and the decision can be taken. The first part, as I was telling you, is a history recording, and second part is initial preparation and plaque control measures. The most factious manner is that we try to do the scaling and root planing, and also try to educate the patient and help in the plaque control measures. Now, both the mechanical methods and chemical methods of plaque control are very much necessary to bring down the plaque scores and to improve the gingival and periodontal health to a larger extent. The moment we try to improve the tissues conditioning and we improve the gingiva, the red gingiva tries to become pink in color and becomes much more firm, and the bleeding tend to reduce to a larger extent. The third phase in which we are trying to manage is by doing a periodontal surgical treatment. Incidentally, the periodontal surgery is not just putting a knife in every patient's mouth. See, we have to choose a patient and find out what exactly is the evaluation of the periodontal scores that is present in the mouth following the initial treatment. Say after 6 weeks or 4 weeks after periodontal cleaning and scaling and root planing, we have to examine the patient and find out how we are trying to improve the tissue conditioning and also the type of periodontal defects, so that we will try to execute our surgical procedures. That pockets also depend on different types. It could be a suprabony pocket with a firm and fibrous lateral wall, or it could be a soft and edematous pocket wall. It could be infrabony pockets as well. So the treatment planning depends on different situations. And the proactive therapy that we are trying to give is by giving a supportive therapy, so that the patient can maintain the treatment what we have done in a larger extent. It's something like teaching a person how to ride a bicycle or teaching a person how to swim, so that he can do it himself, so that he can try to improve his tissues to a larger extent and reduce the amount of plaque and the debris, so that you can try to improve the periodontal tissues a larger way. Now, history recording all depends upon the signs and symptoms which we have undertaken from the patient's mouth, and also we try to find out from the different investigations. Many times, mind you, we will try to get a diagnosis of different systemic illnesses also when we try to do the laboratory investigation. And it's like situations like diabetes mellitus or hypertension, or it could be any such situation which we could try to understand, and we can detect them by doing a laboratory investigation, which the patient may not know himself. Apart from that, it is important that we have to take an informed consent of the patient before we do any treatment, and that is what is prime necessary. After that, when we try to do the data collection, the clinical examination, which will be including the inspection, the probing methods, and of course trying to check the mobility and try to find out what are the changes that have taken place in the periodontal environment by radiographic examination, is also very much factual information that we get. Now, accordingly, we have to find out the differential diagnosis. The patient may suffer from changes like gingivitis, or it could be periodontitis, and of course according to the Armitage classification 1999, it could be adult periodontitis, which we called as normally as chronic periodontitis, or it could be aggressive periodontitis, maybe in the form of localized aggressive or generalized aggressive periodontitis. Now, situations can demand that we would like to examine the patient properly and understand, look, this patient had come for just a dental checkup at my school. Incidentally, I didn't find out any calculus or anything like that. Her gingiva was beautiful, and I didn't find any apt changes that have taken place in periodontal tissues. If I get such a patient, it's certainly that we will be very happy to know and try to do the necessary work. The patient had come for a fractured left upper central incisor in the mesoincisal angle, but apart from that, there is absolutely no such situation. Now, mind you, when we do the treatment, the treatment can be executed by a dental hygienist or general dentist, or it could be by a periodontist. The first and foremost thing, that root planing and scaling and root procedures can be undertaken by a general dentist, or even by a hygienist as well. Now, incidentally, the tissues conditioning is very much important before it is executed by periodontist to do some treatment. Incidentally, the periodontist role comes subsequently after the oral prophylaxis, the root planing and repetitive root planing procedures. Now, devices like ultrasonic instrumentation or such procedures can be done, so that you can execute the work at a faster rate and with minimal amount of injury or tissue trauma or pain. And of course, that would be followed by oral hygiene instructions and patient reevaluation. Usually the reevaluation to take place after, say, about 4 to 6 weeks, so that the tissues are conditioned in proper way and we can try to do the treatment. Now, who is the patient to go for periodontal surgery is a question. Mind you, there are a number of people who suffer from periodontal problems. Not all patients with periodontal pockets may be a good candidate for periodontal surgery. Necessarily, that the patient should have motivation, he should have a proper oral hygiene care. Apart from that, the patient should have sufficient financial support, and apart from that, you will find the patient should be available at our calls, because the patient should not neglect and get away from these situations. Now, periodontal procedures could be undertaken depending, as I was telling you, depending on the lateral pocket wall and also the depth of pockets. And of course, there are different procedures which could be adopted. Maybe a gingival curettage, it could be a periodontal flap surgery, it could be a gingivectomy, or it could be a mucogingival surgery, or it could be associated with some sort of osseous defects where you will find there will be 1-walled or 2-walled or 3-walled pockets and craters or ledges, and such osseous defects could be there. So we may have to do a resective surgery, or we may have to do even regenerative procedures using some graft materials, and that will help to improve the bone height, and therefore we can try to do all sorts of improvements. Now, of course, there are different types of architecture of the bone. You will find that there is a positive architecture, there could be a negative architecture, and all that will be very much helpful for us to understand the logics. And many a times you will find that the osseous defects could be in the form of fenestration or a window-like opening in the bone where the marginal bone is intact, or there could be a dehiscence where you will find that there is a V-shaped cleft that is taking place on the root surface and exposure of the root because of the dehiscence or the breakdown of the bony pocket wall that is present on the labial surface. So, as I was telling you, there could be varieties of gingivectomy procedures or periodontal flap surgeries or mucogingival surgery. Now, gingivectomy is a surgical procedure where we try to excise the supra-bony pocket wall, and that's usually done in situations where the gingiva is firm and fibrous. The periodontal flap surgery is undertaken when there is an infra-bony pocket and where the crest of the alveolar bone is coronal to the base of the pocket. Or you will find that you may have to do a mucogingival surgical procedures where you will find there will be a gingival recession, or there will be narrow width of the attached gingiva, or you will find that there could be shallow depth of the vestibule or attached gingiva that could lead to mucogingival problems. And sometimes even the frenum, which may come in the way of the movement of the lip, and that could also be associated by doing a frenectomy and such procedures. Well, osseous resective procedures are undertaken by use of chisel or mallet, or it can be rotary instruments. The idea is to improve the bone architecture in such a way that the gingival tissue tries to present itself or rest on the surface of the bone in such a way that you will be able to eliminate those sharp defects or altered tissue, bony tissue changes. Sometimes, as I was telling you, the osseous regenerative procedures are necessary to improve the bone height by using bone graft material like hydroxyapatite, or it could be in the form of bone material. Now, sometimes you will find that the mucogingival problems, as I was telling you, may be presented in the patient's mouth, and you will find that you can show some sort of changes that is associated because of shallow vestibule or narrow width of the attached gingiva, and it could be also due to frenum, as I was telling you, or it could be in the form of where the pocket depth exceeds beyond the attached gingiva or beyond the mucogingival junction. So such situations demand mucogingival surgical procedures. Another very important problem that comes to our mind is occlusal trauma. The occlusal trauma is supposed to be a very, very important factor which can bring about changes in the periodontal tissues. Most of the situations, the occlusal trauma is associated with infrabony pocket formation. There's an angular type of defects of the bone, and that is associated because of the improper occlusion, or because of high points, as we call it, or there could be some sort of movement difficulty in the centric position of the mandible, and then from there where the excursive movements takes place, the right lateral, left lateral, or opening or closing movements, and that could lead to such situations. Many a times you will find the gingival enlargement can also occur as a result of, maybe different to condition gingival enlargements, maybe as a result of leukemia, or it could be in the form of vitamin C deficiency, or it could be in the form of pregnancy tumor, or it could be enlargement as a result of, the endocrinal changes. So all such situations can demand periodontal treatment, and we may have to do the surgical procedures to correct the defects which can occur. Now, basically, the initial therapy which I was talking to you was root planing and scaling, and apart from that, the oral hygiene instructions and giving proper education and searching for the good improvement that could occur in the patient's mouth after a particular period of time. Basically, you have to give some amount of time for the tissues to recapitulate or rehabilitate itself, and then we might think of doing a surgical procedure in case if we have to do. Sometimes you may not need necessarily to do it also, because the tissues can improve by itself, and you will find that the depth of the pockets decrease, and you will find the tissue becomes more firm, and you will find the bleeding reduces, and you will find that there is a very, very good improvement taking place. Apart from that, what is important is the maintenance part, and how the patient maintains is also a big enigma for everyone. Sometimes you may have to do a surgical therapy associated with certain graft materials, maybe in the form of guided tissue regeneration, where you may have to use certain substances which are absorbable or non-absorbable materials, which can help to improve the tissues, the gingival tissue, more coronally, and that could be of great importance to improve the tissue architecture. Some different types of flap designs are there, which I would not like to talk too much about it because of the paucity of time. In fact, I was particular for about 1 hour program, but then I was asked to reduce it by about 40 minutes. So I'm trying to present it as fast as possible. And there are different types of flap designs. You'll find the inverse bevel flap, or it may be a open flap, or it could be in the form of sort of a continuous design or non-continuous design, and all those things could be different decided. Well, ultimately our whole objective is to reduce the pocket depth, to improve the tissue conditions. Apart from that, we try to regenerate to a larger extent the lost bone, and keep the teeth more stable in the mouth as far as possible. Sometimes we may have to do an gingival augmentation, which we call it as mucogingival procedures, by way of free gingival grafts or connective tissue grafts or coronally advanced grafts, so that you try to cover the denuded part of the root, and that will help you to improve the tissues to a larger extent. Also to reduce the amount of sensitivity, dentinal hypersensitivity. Apart from that, we'll try to improve the architecture of the tissues also, and reduce the amount of plaque formation, so that you are trying to give more support to the periodontal tissues to a larger extent. Now, it's important that after you do a surgical procedure, you educate the patient, you give instructions, and also call the patient at least once in 3 months or once in 4 months for supportive therapy, and make sure that the patient has followed your instructions to a larger extent. Ultimately, our objective is to help the patient to reach to a larger extent the goal what we want. That means that we want there should be minimal amount of plaque scores, there should be a improved gingival architecture, there should be minimal amount of bleeding, there should be reduction in the pocket depth, and also make sure that the height of the bone also increases by our periodontal procedures. And all these things is also necessary because we have to do the behavioral modification of the patient also, because the patient has his own concepts of oral hygiene. And unless and until we try to change or modify the behavior of the patient or motivate the patient, unless until we do that, we will not be successful. The patient might have spent thousands of dollars for his treatment. And I had one patient who had come from California. Believe it or not, he had undergone all sorts of periodontal surgical treatment, but the patient was not given education at all. He was a professor of management of Indian Institute of Management in Bangalore. And when he came to me by name, Swaminathan, he was surprised that I was giving him some preaching of education of oral hygiene, and which no one had given him for last 20-25 years, where he had undergone periodontal surgical procedures and all those things. So unless you motivate the patient, you will not be able to succeed in your treatment procedures. So it is important that whatever we do should be beneficial to the patient, and it should not be just for sake of money part. Of course, today we are in the era of implants. We have different types of implants. We have got, different types of implants. It could be coated or non-coated, or it could be, of all varieties. But what is important is how do we select a patient of implantology? All patients, again, may not be a successful one for implant therapy. It's important to select a proper case. Make sure that the patient is, as far as possible, a non-smoker, is having less of periodontal breakdown. Apart from that, you should be, free from diabetes, and all those things are very important criteria. Make sure that the patient has a proper implant modality also, and so you have to do a proper reconstruction and improve the bone regeneration procedures and help the stability of the implant, and that will help you to provide a proper aspect of stability of the bone and the implant. Many times after the implant therapy also, you will find that the patients do suffer from peri-implantitis. In such situations, we may have to do a initial therapy, scaling, tooth planing, and all those things. Of course, many a times when we do the peri-implantitis, we have to use separate type of instruments also for that, gold-coated instruments and all those things. And that could be of great help in treating such patients. Apart from that, what is important is we consider our treatment also as a part of aesthetics. Aesthetics is kept in mind, especially when there's a high lip line, gingival augmentation, and all those things are present. We may have to do a treatment in such a way for the maxillary upper anteriors to improve the tissue, the smile line. And also many a times the patient will have a lot of pigmentation on the gingiva, and the patient himself will come, doctor, look, my teeth or my gums are very black in color. So in such situations, we may have to do some depigmentation procedures, either by using a laser or by a surgical therapy, where you will try to remove the superficial layers of epithelium and connective tissue, so that you will try to depigment that area, and that could be of great help also. Many a times you may have to do some restorative procedures also to improve the smile design, and you will find restorative spaces could be closed by doing restorative appliances, maybe in the form of proximal cosmetic, maybe a sort of restorative therapy, and that could improve the maxillary lip line, and that's also a very important part of our journey. Many a times when we do a periodontal surgery, we may have to do a periodontal dressing also, especially when you do mucogingival surgical procedures, or when we are trying to do the regenerative procedures. We have to protect that area, as a matter of fact, by providing periodontal dressing. It could be eugenol containing periodontal dressings or a non-eugenol containing periodontal dressings. Ultimately, periodontal dressings are given to protect the tissues as far as possible. We try to reduce the amount of plaque in that area of the field of surgery. Apart from that, we will help in stability of the teeth. At the same time, we will try to make sure that the patient has got a faster healing in the area as far as possible. Many a times we may have to do a redressing also, especially when you do a vestibular deepening or mucogingival surgical procedures. Just giving periodontal dressing for once may not be sufficient. In fact, you may have to do redressing for a period of about 2 to 3 weeks or even more, so that whatever depth of the vestibule you have created must be maintained to a larger way. And another problem that a patient confronts whenever we do a periodontal surgery or the patient undergoes treatment is dental hypersensitivity. This dental hypersensitivity is because of the exposure of the dentine to the oral environment. and that could be associated with, you may see that even 1 millimeter of exposure of dentine causes 30,000 dentinal tubules to be exposed. So you will note that the patient will have dentinal hypersensitivity. At the same time, we have to make sure that the patient tries to get this problem solved by using of certain dentifrices containing fluoride or potassium nitrate containing toothpaste, so that you will try to reduce this amount of dental hypersensitivity to a larger extent. You can even topically apply that paste on that area where the patient has got sensitivity and wait for a minute or so and then try to rinse his mouth or brush his teeth. Similarly, you can use certain amount of mouth washes or mouth rinses containing potassium nitrate or fluoride that could reduce the amount of dental hypersensitivity to a larger extent. So again, another problem that comes to our mind is crown lengthening. Many a times what happens, when the tooth is broken or the crown fractures, we'll find the residual root stump is still present, and we try to do a protection by doing a root canal for that, and then we try to expose the portion of the crown to a larger extent by chopping off the margin of the gingiva and exposing the crown to a larger extent, so that crown lengthening takes place, and then over that we can put a restoration by way of a ceramic or maybe a zirconia crown prosthesis, so that we will try to prevent the extraction of the tooth to a larger extent and try to prevent further damage to the neighboring teeth as well as possible. So these are some of the procedures which we try to undertake in our dental procedures, in periodontal procedures. Many a times we also make use of some chemotherapeutic agents, maybe in the form of local drug delivery. Many a times like chlorhexidine or metronidazole or maybe atrisorb, periostat, chlorochip. All those things are different devices by means of which we are trying to use and try to reduce the amount of periodontal bugs that are present in the oral environment. Most of the situations, if we try to control the harmful microorganisms, we will surely make sure that the periodontal breakdown too is a minimal extent. Similarly, periostat is a drug which is called a sort of chemically activated tetracycline, which is supposed to be a very important agent which can reduce the breakdown of periodontal collagen. And this particular anti-collagenous activity of this drug, doxycycline hyclate, is supposed to be of great importance nowadays, which is being used in America and other places by the small tablet called Periostat, which is about 20 milligrams strength, and that can be given twice a day and can be given for about 6 to 8 months in a longer period of time, and that has got not much a toxic effect on the tissue, on the body, and however you can try to alter the periodontal microorganisms to a larger extent, and that can protect further breakdown. So as I was telling you, this is the one which is used for host modulation, Periostat, doxycycline hyclate, and some modified type of tetracycline, which is of great importance. Of course, we have also come into the world of lasers, and laser therapy has been of great interest for everyone because, number one, laser, when you use laser, you'll find there's less bleeding. Of course, there will be less amount of tissue trauma, and you can use it for gingivoplasty, or you can do a pericoronal flap excision with this particular method. Sometimes laser is also used for bleaching of teeth also to a larger extent. Well, as I was telling you all these things in such a short time, periodontics is associated with a multidisciplinary approach for care and management. We may have to use the procedures with restorative dentistry, we may have to make use of orthodontics, we may have to use crown and bridge prosthodontics, or even implantologists help, and all this can be of great helpful for us to make our decisions and try to make sure that whatever is remaining in the mouth, we should preserve them than to extraction. The whole concept was by Divan, who said to preserve what remains in the oral cavity than doing meticulous restorations, and that was, we are following it today also. The treatment is only successful if the learner has learnt with experience. Means a person who is a doctor, who is a dentist or a periodontist, he should have learnt his procedures, and he should learn with experience also. And unless and until we try to do the procedures with experience, we will never be successful. And also make sure that the patient also comes back and he follows his approach for his home care and all those things.